want to talk about this story about the Avastin and the Lucentis. It's a fascinating story that was in the Washington Post, and it is just one of many stories that give you an indication of just why it is that this country pays double what any other Western industrialized country pays to provide health care on a per capita basis to its citizens. And I'm not just talking about what is spent on in the private sector, but also even the public sector. So we spend even more per capita, more than any other Western industrialized country. And we don't, as a government, and we don't cover. We don't ensure access to health insurance still for all of our citizens in this country. But this is a perfect example. And this is also, I don't know if this is something that is specifically indicative of the dynamic that'll be created under the TPP and its cousin. I don't know what they call the EU partnership or something opaque like that. But there are two drugs out there that are used in the treatment of a degenerative eye disease, wet master. I don't know what the wet age-related macular, I should say, degeneration. And this is apparently as you get older, your macular degenerates, and you can go blind.
How's your macula doing, Sam?
I have no idea, but I imagine not well. The treatment, the official treatment for this, is a drug called Lucentis. It costs $2,000 per injection. It has been developed by a company called Genentech, which is a division of the Roche Group. Prior to releasing Lucentis at $2,000 per injection, Genentech years earlier had released a drug called Avastin, which was used in the treatment of different types of cancers, colon cancer, other types of cancers. At one point, a doctor, when they were trying to figure out how to treat, this is prior to Lucentis being developed, when they were trying to figure out how to treat this degenerative eye disease, a doctor started to experiment with Avastin, using it in basically an off-label use is what they call. They were testing it in the same dosage, and they stumbled across the fact that it was helping this eye disease. However, the drug Avastin, given in that amount, has a lot of difficult side effects. So they cut the dosage and directly injected it essentially close to the eye or in the eye. And they found that it was incredibly effective for this ailment. And they did so before Genentech, which apparently had also realized this, had come out with Lucentis, which is essentially, according to a Toledo ophthalmologist who founded a group called Physicians for Clinical Responsibility, they found that Lucentis is Avastin. It's the same, this is a quote, it's the same damn molecule with few cosmetic changes, i.e. dosage size. And so what was happening before the development of Lucentis, and continues to happen, was that secondary drug companies were buying Avastin, cutting the size of the dosage, reselling it to doctors in a lower dosage, one that you can actually give easier to the patients in terms of an injection, So there's no questioning how much you've actually pulled out of whatever the injection is. And it's being treated. So about 50% of the doctors out there use Avastin as repackaged by other companies. And 50% use Lucentis. The question is, obviously, why would you use Lucentis? And that is because doctors, when they are administering a drug and are being reimbursed by Medicare, get a 6% markup from the cost of the drug. Even I can do this math. 6% of $50 is around, I don't know, $2.75. 6% of $2,000 is closer to, I don't know, what, $170? On top of that, Genentech offers rebates to doctors who use large volumes of the more expensive drug. In other words, kickbacks. Because they're not going to pass that kickback on to their patients.
They should be able to profit too. After all, we are not communists.
That's right. And unfortunately, the FDA does not have the ability to compel Genentech to get Avastin approved for the use in the treatment of this drug. Now, because it's off-label and because it's found to have, it's already been tested in terms of safety, and because we actually have a drug regime in this country where you don't have to prove that a drug is actually effective or more effective than another drug to sell it in that way. In this instance, it is helping people because the drug company refuses to apply for a license for the cheaper drug. So this just goes to show you just how bizarre our system is in this country. Now, if we had Medicare had the ability to say, hey, you know, we're not going to provide reimbursement for Lucentis because there's no point in that. You can get a drug that is 40 times cheaper. It is proven to be just as effective. There have been 6 clinical trials now that have shown that it actually is as effective and is no less safe. In fact, the only safety issues that come up that are infinitesimally small but exist are in the processing of Avastin into smaller doses and being resold. There was a scare about this in some other drug. I can't remember what it was a couple of months ago because you have some of these repackaging companies where there's potential for contamination. So we have no authority in terms of like Medicare to say we're not going to reimburse you for this clearly more expensive, less effective, or I should say equally effective drug. And so doctors continue to charge Medicare for this. You're talking billions upon billions of dollars simply wasted because a company has figured out, like, we can put up our sort of more expensive label designer version of this drug, which does the exact same thing. And Medicare, one of the biggest buyers of this, payers for this drug, essentially, they're not buying it. The doctors are buying it. Buyers of this drug, or I should say payers of this drug, they can't do anything about it. Because Sarah Palin will be out there screaming death panels. You're not allowing these people to inject themselves with the exact same drug and a 40 times more cost point. It's communism. And as far as I can tell, that there's a provision in that TPP that would prevent countries from sort of making those types of determinations. I don't know if it would apply in this necessary set, but that's the dynamic. So this is another installment of this is why our medicine and medical treatment in this country costs so much more than in any other industrialized nation. It's because we allow this, I don't know how I would call it fraud, but snake oil, essentially, to be legalized. Or the snake oil packaging, maybe.